just need to make a quick disclaimer that I do have some graphic photos of some of the patients that I've seen throughout the years. So I hope they're not too graphic but I just need to share that with you before I get started. So we're going to start off with some fun foot facts. Approximately 20% of the population has a Morton's toe. A Morton's toe is where the second toe is longer than the first. So 80% have their second toe shorter, and that 20% has a second toe that is longer. The health professional who takes care of the feet is a podiatrist. 30% of women will develop a bunion in their lifetime. Men also get bunions, and bunions are not caused by the shoes that you wear because children can have bunions, and you don't see a lot of children running around in stilettos. So, bunions are inherited. We inherit our foot structure from our family members, whether maternal or paternal, but at least 30% of women will develop a bunion. And it is made worse if you wear shoes that are pointy toe. There are 8,000 nerve endings in the feet, making the feet the most ticklish part of the body. Some of the following medical conditions can be initially detected in the feet: diabetes, heart disease, peripheral neuropathy, cancer, and arthritis. Diabetes is one of the main reasons a person would see a podiatrist. A podiatrist is on the diabetic medical team along with your endocrinologist and your cardiologist. If a person has heart disease, they could have narrowing of vessels in their feet, causing a variety of problems from cold feet to uh, getting sores on your feet that don't heal, peripheral neuropathy, of course, when you cannot feel your feet, whether you're putting your feet on the floor, you can't tell whether the gas pedal or the brake pedal is what you're touching. Cancer can be found in the nails or on the skin. Uh, if there's a wound that's not healing, it could be cancerous. And arthritis. Arthritis, there are many different forms of arthritis, and we're going to get into some of these um, disease entities as we go through this presentation. There are 250,000 sweat glands in the feet, producing 1/2 pint of fluid daily. Now, some people have a condition called hyperhidrosis, meaning their feet and their hands just have a tendency to be sweaty, and they may need to change their socks 2 or 3 times a day. But there it is, 250,000 sweat glands in the feet. It takes between 9 and 15 months for a toenail to grow back. So, ladies, I could say men as well, because everybody paints their nails in this moment of history. If you leave your nail polish on, you will see that it grows out between 9 and 15 months. Rarely are 2 feet on a person the same size. We're bilateral, but not necessarily symmetrical. Most babies have flat feet, and an arch develops over time. If a baby has an arch in their feet, unfortunately, most likely they have some kind of neurological condition. 1/4 of the bones of the body are in the feet. The other quarter are in the hands. Moses Malone, who was a basketball player in the 80s, used 4 pairs of sneakers per basketball game. So he had to change out his sneakers every single quarter. And shocker, women walk more miles per day than men. Some common foot conditions are plantar fasciitis, which is not necessarily caused by heel spurs, because a lot of people have heel spurs that are asymptomatic. But plantar fasciitis is when the plantar fascia, which is a band of tissue that attaches the bottom of the toes to the heel bone, some of those fibers are pulled away from the heel, and you have that burning, shooting pain as soon as you get out of bed. You can't hardly walk in the morning. That's when you know that's a classic symptom of plantar fasciitis. Bunions, there are different kinds of bunions, and I have some pictures of bunions. People also have flat feet. Flat feet in and of themselves do not necessarily cause pain if a person is wearing the proper shoe wear, but if they become painful, then we can dispense orthotics and give you some foot exercises in order to strengthen your feet. The most common condition that I see is thick toenails. They could be fungal, they could have fluid under them, they could have all kinds of bacteria and yeast and mold, all kinds of organisms under the nails. There are calluses that can be on any bony prominence. One of the questions that's often asked is, if a callus is removed, why does it come back? Well, a callus is not a skin problem, it's a bone problem. And calluses build up in order to protect the underlying bone. Ingrown toenails, when the toenails grow into the corners, and I also have some pictures of that, they could either grow into the size of the nail, or they could actually grow over the top of the nail. And of course, diabetic foot care. Why house calls? Why does anyone need a house call? Well, a podiatrist is able to provide professional services in the comfort, safety, privacy, and convenience of the home. Sometimes a person may have just had surgery. They might have had hip surgery or knee surgery, and it's just not convenient for them to get out. And that may not be an elderly person. It could be someone who is in their 40s or 60s. Or the person could be bedridden, and it all but house calls also enhance the doctor-patient relationship in that we're not limited to 5 or 10 minutes with our patient. We're able to spend as much time as is necessary to deliver the treatment that is best for the condition that the patient presents with, which also is individualized one-on-one attention. Once again, there's no time limit. When you go to an office, you have 5 to 15 minutes, sometimes rarely 30 minutes with face-to-face with your physician. The ability to provide the medications for follow-up care at home so that the person who's being treated does not have to go to the pharmacy to pick up any medications. Either the medications are delivered at the time of the appointment because a podiatrist has them in the car, or they can call in a prescription mail order for the follow-up treatment of the condition that is being presented for at the time. No need to go out in inclement weather or deal with traffic. And of course, if the patient is bedridden or they may be on hospice and it's just no longer convenient for them, or it would take half a day at least for them to go to the doctor and get back home. This is a very important slide that I chose to include because people don't understand how amputation affects the lifespan of a person. If a person has poor circulation or they may have cancer and they need to have a limb amputated, you could see that amputation is a greater predictor of mortality than Hodgkin's disease, breast cancer, or prostate cancer. If a person has an ischemic ulcer, which means that there is no circulation and the ulcer is usually very painful, that's more predictive of death than colon cancer. And you can see that arterial disease is a great predictor of mortality, almost as great as lung cancer and pancreatic cancer. So when a person includes a podiatrist as part of their healthcare team, they're able to extend the quality and quantity of their life because these diseases that are detected in the feet can be more or equal to uh, equally as detrimental as some of the cancers. There's a campaign that the American Podiatric Medical Association launched a few years ago entitled Take Off Your Shoes and Socks. A lot of times when we go visit our parents or visit our aunts and uncles, they have their shoes and socks on. And you don't know how long they've had their shoes and socks on. Do they change their shoes and socks every day? What are they hiding under their shoes and socks? When an elderly person can no longer trim their toenails, either because they can no longer see their feet or they don't have the strength in their hands anymore, they are ashamed a lot of times. And so you don't know what's going on in their shoes. So it's very important to make sure you have them check out their shoes and socks. Yeah, I mean, have them see their feet so that you can see what is going on. And as I said, arthritis can prevent them from using nail clippers. They may be overweight and their arms are now shorter, so they can no longer reach their feet. And the family may not be able to or may not want to hurt their loved one. So they need to call in a podiatrist to take care of that situation. Now, this is a person that I actually saw with, they hadn't had their nails cut in about a year or 2 years. So you could see that even after treatment, um, it's going to take a while for those nails to grow back. Now, these are ingrown toenails. You could see how the nail is actually curving around the nail bed. And this person is fortunate, excuse me, in that her nail did not pierce her skin and become infected. When that happens, granulation tissue or this red, angry looking tissue comes out of the skin. And that is a situation where the nail definitely has to be removed and follow up care needs to be instituted in order to get the nail back to normal. I had some other pictures, but unfortunately I was not able to include them in the slide presentation of what those granulation and some nail infections actually look like. This is a picture where you can see the nails growing over the top of the toes. So that's a ingrown toenail condition on the dorsum. And when you cut the nails, they actually leave a mark. You could see the deep grooves that are on the side of this toe. And that's all from the pressure that the nail put on the toe. This is what I like to do in my spare time. So we're going to move on to claw toes, hammer toes, and mallet toes. We could have 3 different kinds of toes on our feet. A hammer digit is when one of the digits, one of the joints in the digit is bent. Each toe, except for the big toe, has 2 joints. So when both joints are bent, it's a claw toe. When the furthest joint is bent, it's the mallet toe, similar to a mallet hammer. And when the proximal joint or the closest joint is bent, it's a hammer toe. And each disorder is caused by a muscle slash tendon imbalance. or it could be caused by trauma. If somebody wears shoes at a young age that are constantly too small, your tendons are going to retract in order to fit into those smaller shoes. So if a woman likes to wear high heels all the time, that's causing tendon imbalances as well. And our feet like to make us happy, so they're going to just go with the flow until they become painful and they rebel against us. So this is actually a claw toe, and you're also able to see a bunion because the toes are bent at both joints. This is a claw toe as well, that second toe. And you could also see how it's starting to overlap onto the big toe. What I don't have a good angle for this picture, the big toe is moving over because of a bunion, and that allows the second toe has no place to go, so it starts to encroach upon the big toe, and eventually it may cross over. So sometimes you see people who have their first and second toes cross like they're um, crossing their fingers, but that's usually due to an unresolved bunion that's just gone on all their lives, and it caused the second toe to move out of its normal place. Also, when a toe is clawed like that or deformed like that, it also indicates that there is a dislocation of the joint. There's a dislocation of the long bone, which is the metatarsal, on the toe, short bone, which is the proximal phalanx. So that's also a dislocation. And this is another picture of hammer toes and bunions. Arthritis is a very common condition in the feet. It's a progressive degenerative disease that can affect anyone at any age. There are different types of arthritis. Rheumatoid arthritis is the deforming arthritis where the toes and the are usually crossed over each other and the metatarsals are dislocated on the proximal phalanx. So the it's very difficult to wear shoes when a person has rheumatoid arthritis. Another condition that goes along with rheumatoid arthritis is plantar fat pad atrophy, meaning when you look at a baby's foot, it's nice and pillowy and soft. And as we age, all that fat that we would like to stay in our feet goes to other areas of our body. So with arthritis, we don't have that cushion, that fat that should be on the balls of our feet. So it's very common to get calluses there as well. Osteoarthritis is wear and tear arthritis. It's when our bones actually just degenerate over time. It's usually not as deforming, but it still is painful. And usually you get osteoarthritis in your knees and in your hips, but you could also get it in your feet. And psoriatic arthritis is a type of arthritis that manifests itself on the skin. So if a person has nails that have a tendency to be pitted, and if you look at an x-ray of their feet, you will also notice that their bones have a different, they're like a pencil structure, so they're no longer as the shape that they should be. That person also has psoriatic arthritis. Psoriasis also forms plaques on the skin. And so it's on the skin, it's on the nails, and it also affects the bones. There are other immune disorders which have manifestations in the feet, scleroderma, which is another form. What it does is the skin gets tight and taut and it's also a very painful condition. Then there's ankylosing spondylitis, which has manifestations in the back. And these are just a few of the other conditions that rheumatologists treat that can also have manifestations in the feet. And this is a condition where someone has rheumatoid arthritis. You see how they appear to have a bunion, their toes are misshapen and malformed and dislocated. So this is a person who has rheumatoid arthritis. We're going to move into pain relief. There are several different pain relief techniques. One is topical. You have your biofreeze, you have your CBD, you have your Vicks Vapor Rub. There are injectables, your cortisones. There are anti-inflammatories, which are your Tylenol, your Aleve, non-steroidal inflammatories that can be prescribed, Motrin, and various things like that. You have TENS units, which are very popular, that can be placed on the area of pain, and it delivers electrical signals to block that pain. There's also laser therapy, which I'm going to get into a little later. There's shockwave therapy that also applies shocks, or it's a non-invasive therapy to the area of pain that's usually used for heel pain or tendon pain. And then there's electric cell signaling therapy delivered by a Synexus machine. So mentioned some of the topicals before. There's Vicks, Vapor Rub, Biofreeze, rubbing alcohol. A lot of people swear by rubbing alcohol, whether it's wintergreen or just regular alcohol. Epsom salt soaks, CBD products. There are a lot of topical CBD products out there now. Dr. Hoy's, which is also a topical product similar to Biofreeze that actually it works instantaneously. It's amazing. And there are a lot of other products out there that you could rub on topically that will temporarily stop the pain. Disclaimer, Dr. Hoy's is one of the products that I used when I had hip pain, and I put it on, and it lasted for months. It was not a short-term pain reliever for me. So that's something I recommend highly. There are injectables. So when you go see your podiatrist, you may have bunion pain, you may have plantar fasciitis, you may have Achilles tendonitis, or any gout. They will give you an injection of lidocaine and dexamethasone, or they may give you celestone Solispan. There are a lot of different injectables out there. These reduce the inflammation. They will stop the pain temporarily, but as you know, injections are painful and they can weaken the tendons and ligaments. Therefore, you should only have about 3 injections in any particular location. So, nerve regeneration, lasers. I never really thought about God creating light as the first thing that was created. So light was created, and then 4 days later, the sun and the moon was created. So light is necessary for life. And lasers give light, and it penetrates into the cells in order to heal whatever is going on in the body. I like using laser therapy because it's effective. Usually after 5 minutes of treatment, the person feels better. It's pain-free. No injection is needed. You're not feeling anything, and you're able to receive a pain-free status. There are no negative side effects. There are no drug interactions. There's no potentiality of getting addicted to anything. There's no downtime. You're able to walk and do any activity that you had planned to do for the rest of the day, and they're non-invasive. So there are some dermatological conditions that are treated with lasers, wounds and ulcers. And I do have a picture of a wound that was treated with lasers, and they went from gangrene to a normal heal in about 8 weeks. Their allergic reactions. There's this one patient I had, and I really wish I had those pictures, that she had an allergic reaction to a lotion, and after 2 treatments, actually, her skin was completely normal. And there's psoriasis that can also be treated by laser. Hemosiderosis is when a person has venous disease and their legs turn dark. And sometimes your legs turn dark because you had swelling, and then once the swelling resolves, the discoloration in the skin continues. Lasers are able to heal that as well. And there's also scar tissue that can be resolved with lasers. This is a picture of a thermal laser. A thermal laser is different from a cold laser or non-thermal laser in that a thermal laser, you could feel the heat emanating from the laser, whereas when a person is receiving a cold laser treatment, you may feel a little tingling, but you are definitely not feeling heat. The thermal laser is good for warts, and it is also some people like it better for arthritis type pain because they like that feeling of warmth. But it's really not any more effective than a cold laser. The EVRL laser. EVRL stands for Erconia Violet Red Laser. This is a laser that has red and violet light. Now, the lights have a different level of penetration, and that's why this company got FDA clearance for this laser so that it can penetrate and heal infections. It could also heal acne. It heals plantar fasciitis. It works for a lot of different situations a person may have in their body. Um, it's good for fungal nails. If a person has the violet laser is good for microbiome. So any kind of infection, it's good for that. The off-label use, off-label means it hasn't been FDA cleared. So some people who've had COVID have used this to heal some of their congestive lung conditions as a sequela from COVID. Um, if a person they're congested from allergies or they're congested from a cold, and you use the laser on their head, they are able to drain their sinuses. So these lasers have a wide range of functions from the head all the way down to the feet, but because I'm a podiatrist, I can only treat mid-calf to the foot. Even in treating the feet, some people receive benefits throughout the rest of their body. So about 2 years ago, they came out with a green violet laser, and this laser proved to be even more effective in pain relief, more effective than the red violet laser or just the laser alone. It is 7 times more effective than LEDs. LEDs are very superficial. They do not penetrate down as far as the laser, and it's 100 times more effective than the infrared laser. So the infrareds, the LEDs are products that you could purchase commercially. You could get them from Amazon. You could get caps that will help your hair to grow back. And these are very non-invasive. They do have some positive effects, but if a person has greater cellular damage from chronic or acute injuries, then a laser is going to be definitely more effective than an infrared. Personal story, a couple of years ago, I fell and I broke my wrist and my arm, and I needed to work. So the accident happened on Wednesday. Went to see an orthopedist on Friday. He gave me a removable cast, and I lasered myself once I got that removable cast, and I was able to go to work on Monday. When my wrist was broken, I had no strength at all in my hand, and by Monday, I was able to work again. Now, when I went back to see the orthopedist 5 weeks later, he was really shocked to see how well I had healed. So, these lasers not only treat your neuropathy or bring circulation to the area to heal wounds, but they also help in healing bone. And unfortunately,
as of 2018, 100 million people in the U.S.
it's a short video.
suffer from chronic pain. Today, therapeutic advancements in the world of electric cell signaling are presenting new options for patients with some surprising results.
This machine offers the opportunity for a wide variety of problems: acute pain, chronic pain, neuropathy, visceral pain, pain inside, almost everything you can think of, because you can treat somebody virtually without risk.
For the last 10 years, I have been trying to find something to relieve this neck pain. Gone to the chiropractor, cupping, you name it, I've done it. Finding RST and doing EMT, it has literally changed my life. I was in complete shock with how good I felt afterwards. It was like a miracle worker. To anybody out there who is looking for something, don't give up. This is it.
Synexus, a breakthrough in pain management treatment. For more, visit rstsynexus.com.
So Synexus is another modality that I use in order to enhance wound healing as well as decrease pain and inflammation. Also, it works 87% of the time with neuropathy. When a person is diagnosed with neuropathy, they usually are given a prescription for gabapentin or Lyrica or Neurontin. Those are 30 to 40% effective. A lot of times people have side effects. They are not going to regenerate the nerves. They are just to allow the patient to get sleep possibly, or to decrease the pain that comes with neuropathy. You have to take the medication 3 to 4 times a day. And after taking it for 10 years, as some people take it for, they are no better. As a matter of fact, the effects wear off. So these therapies and modalities work non-invasively, and because our bodies are made out of electrical cells and light, we are able to heal better using these non-invasive techniques. My very first patient that I used Synexus therapy on, he was in his 90s, a veteran. He had years ago frostbite from when he was in the military. And because he was in a facility, he developed a wound on his heel. Because he wasn't doing well, they put him in hospice. And after 8 treatments, he started getting better. He was able to walk. They took him off hospice. His quality of life improved tremendously. His wife was so pleased that he had a greater quality of life for the 8 months, or actually it was about a year and a half after I treated him, that this therapy actually worked for this gentleman, and he did very well after his necrotic wound healed. Okay, so wound healing. There are many products on the market that assist with wound healing. There are allografts and autografts. These products are very expensive. They run in the thousands of dollars. There are stem cells, there's fish skin grafts, synthetic wound mates, just tons of things out there for wound healing. Now, whether or not a physician uses these or it's used at a wound clinic is usually dependent on reimbursement, whatever the patient has or Medicare decides to reimburse. But unfortunately, what Medicare gives, Medicare can also take back. So at one point in January, let's say, they'll approve allografts, and then by April, they'll say, okay, well, we don't want to cover this anymore. Give us all the money back that we paid for this. And the physician is out of thousands of dollars. So I don't use any of these products. They do work, but depending on whether or not a person is willing to pay out of pocket or get reimbursed with with the hope that they don't have to give back the money that they were paid, I have a tendency to stay away from these products. So this is the patient that I had that had gangrene, and I went through the slides quickly because I don't know who's watching, and I don't know that you may not want to see all that. But just to show you that you can get healing after a patient has had gangrene. I know back in the day, if a person had gangrene, the first thought was amputation, but that we try our best to salvage all limbs, because once a limb is amputated, then the quality of life, even if the person is bedridden, the quality of life goes down. You become depressed, and you just are not able to function as well as when you have your limbs intact. In conclusion, feet are to last a lifetime. We only get one pair, even though they make all these artificial limbs at this time, but it's best to keep the pair that you're given at birth, and we need to keep them healthy. I like this quote. When you get what you want, that's God's direction. When you don't get what you want, it's God's protection. And that's my little grandniece.
We have some questions here, and I'll be reading them to you, okay?
Okay.
So, from Kathy, her question is, does original Medicare Part B cover your home care visits?
I've been practicing for 39 years. For 30 of those years, I took Medicare, and I no longer accept Medicare. I did meet with another group that does take Medicare for podiatry services. They do not go everywhere, however, but I practice in Maryland, all over Maryland and DC, but I do not accept Medicare.
All right. Here's from Gregory. Can you explain what the predictors of mortality signify? Aren't we all going to die? I don't know if
Yes, we
that's
are.
meant to be a serious question, but yes, please go ahead.
Yeah, we are all going to die, but most of us would like to die in our sleep peacefully without any pain. If we have mitigating factors such as diabetes, high blood pressure, cancer, stroke, any of these conditions, they can shorten our life. And we want to live a long, healthy, pain-free life as possible. And that is why When a person gets cancer, you say, okay, well, how long do I have to live with this cancer diagnosis? Pancreatic cancer, a month to a year. Breast cancer, every person is different, every disease process is different, but our goal, I believe, as individuals is to live as healthy and happy as we can.
Awesome. Anyway, here's a message from one of our anonymous attendees. Thank you. This is a very important subject. I appreciate this webinar presentation happening today. Thank you
Thank
for
you.
that. All right, here's some from another anonymous attendee. I have significant swelling in my left leg. In talking about laser therapies, would this help something like this? I have congestive heart failure and other disabilities, and it's probably the vein in the leg that's an issue. So I'm wondering if is this something to look into?
It is possible that it could help with congestive heart failure. That is really the cause of your swelling, and getting the fluid down around your heart. So with congestive heart failure, the goal of the physician is to get the fluid from around your heart. And one of the places it goes, the most dependent place, is the legs and the feet. So it's less harmful to the body if your feet and legs are swollen versus fluid around your heart. Laser may help. I can't guarantee that it will help. Laser and the Synexus therapy can work for inflammation, but it is a long course, and there's also compression that needs to go along with that. But it really is important to coordinate care with your physician to make sure that the fluid that's being pumped out of your legs and feet does not end up back around your heart.
All right, all right. Here's another. Does laser or Synexus work for back pain too?
Yes, it does. Definitely works for back pain, and both modalities work for back pain, but unfortunately, I can only treat the feet. I believe there is someone if you go to the Synexus website or call the company, they can tell you what physician offices carry that therapy.
All right, all right. Here's from Carol. Can you treat yourself with laser therapies?
Absolutely. I rent out my lasers. They are handhelds. They're completely mobile, and you can definitely treat yourself.
All right. I guess those are the questions for today. Dr. Andre, are we gonna give them a copy of the slides? Turn it into a PDF? Is that okay?
Sure. I don't know how to do that, but if I could figure it out, I'll be more than happy to share that with you.
Okay, all right. We'll just talk behind the scenes regarding that.
Okay.
Cherry Thomas here is saying, "Hi there, thank you for this session." I wonder if she's gonna have a question for us, but as we are waiting, if I could just take this opportunity to invite everyone for our next coffee chat. Of course, thank you very much, Dr. Andre. As always, you have given us a wonderful, wonderful time, wonderful, wonderful nuggets of, you know, nuggets and pieces of advice, ideas in order for us and our elders to have more comfortable quality, better quality of life, right? Anyway,
Yes.
for our next coffee chat, it's gonna be for the 18th of September. Again, another third Wednesday. I'm leaving the link for you guys to register, and also I'm gonna leave a link for you guys to Yeah, because we're speaking of ALZ, Alzheimer's, I'm going to give you a link to support our Visiting Angels team as well. VA team for the end to ALZ, walk to end ALZ. So that's it. Anyway, here's a question from Cherry. Can any of the laser treatments be used in the UK? And where can we get the handheld instruments from to use at home?
Okay, yes, there are definitely physicians in the UK that are using laser. You can the lasers that I have are sold by Erchonia, Erchonia. I'll put that in the chat. Corporation. They have an upcoming seminar in Asheville, North Carolina, at their headquarters next month. I spelled it wrong. So if you, and there are plenty of videos on YouTube with Erchonia lasers. Usually chiropractors are giving the webinar on YouTube, and they could show you. They have a lot of 1 minute TikToks, I guess you call them, or 1 minute or even less than 30-second laser one treatment challenge videos where a person had just one treatment and they could tell you and show you actually how much better they feel and their range of motion has increased. So that's where you can get the lasers. They're not cheap.
Okay.
The lasers cost more than my cars. So
Wow. So would you rather have them if you know, what would you have people do? Would you like
well,
advise them to rent out or just
I would
purchase?
advise them to rent out if they, there might be people here who are, millionaires and they have tons of money and they buying one would not be an issue. So, you know, I don't know that they sell them to non-medical professionals, but you could contact the company.
Okay. So yes. Um I guess I guess that's it. We have answered everything here. Anyway, for those for those who have joined us, thank you very much. It was nice being with you, spending this third Wednesday of the month with you. And again, as I've mentioned a while ago, for our next Wednesday, we're having ALZ as our topic, Alzheimer's. So, Dr. Andre, thank you very much in behalf of everybody here and the Visiting Angels team. Thank you and more power to your advocacy. Everybody,
Thank you for having me. I appreciated having this time to share information about the need and the importance of podiatric treatments.
all right. Bye bye, everyone. See you again
Bye,
next
everyone. Have a great
time.
day.
At Visiting Angels, we're committed to enriching the lives of elders and their significant others. Our monthly coffee chat sessions aim to make your lives easier and better by providing quality information from our expert panelists. We're here to elevate your quality of life, offer practical wisdom, and ensure you have access to valuable insights. See you again next third Wednesday of the month.